So now you're out there, you're like, all right, well, it's probably something else, probably my neck.
It's probably my neck.
What
now
do I
what do
do?
you do?
What do you do?
Now, honestly,
Yeah.
you're kind of SOL, right?
Yeah.
And it sounds like really,
No, I know that you're going to say you can make a consult with me.
right. So it
'Cause-
sounds self-serving to say that, and then
Yeah.
you're like, well, who else treats like this? And it sounds kind of assholey to be like, nobody.
If they don't want to make a consult with you and they have a physical therapist that they're comfortable with, could they express this to their physical therapist? Hey, check out this part of my spine.
They can,
Or is there
but
any
again, like what I
exercises?
said, most PTs, their checking out of the spine is, for just brevity and lack of a better term, is trash.
Yeah.
It's watching you move it, and then when you say you don't have any pain, they move on.
Gotcha.
One of the most clear things that I do, right, is I push on the individual levels of the spine, centrally and unilaterally. So I push on the spinous process, so that bump that sticks out, and then I push on the sides, more like the facets. People are so surprised when I put light pressure on a certain area, and they basically jump off the table, and they're like, "What was that?" And I'm like, "Well, that's your problem." Right? And it's clear to me, it's very clear to the patient, because I press on other levels that they're like, no, that just feels like pressure, it doesn't hurt. And then you get to this level and they're like, ow. And I show them, I'm like, look, I'm putting basically my elbow, or basically my arm is resting on you.
What does
through
it
my
feel like?
thumb. It feels like a real sharp pain.
Okay, like a stabbing.
Kind of like a stab.
Alright.
Yeah. It'll often reproduce their symptoms. Like you're pressing there and it's going to my shoulder. Like, yeah.
Interesting.
Right. But that skill was learned by being certified in Maitland. So that it's a certain Maitland technique of pressing on the spine in certain areas with certain levels of mobilization or grades of mobilization. And that skill gets refined over the years. Like after you've pushed on 10,000 people's spines, you get better at it, right?
Yeah.
So now you need to find somebody that is certified in Maitland, and you need to find somebody that's certified in McKenzie. Because it was basically putting those two together and making some small changes is what really built my program, what built my methodology. So if you want to find somebody, a physical therapist that is both certified in McKenzie and Maitland, go see that person.